Currently, we have 587 patients hospitalized and just over a dozen ICU beds in the whole county available. That number fluctuates, as we've explained before, and we still remain very severely impacted in our critical care and hospital capacity. The state is rating us at 0% ICU capacity on their regional dashboard estimates.
We are already on the brink, and that we are seeing the consequences of the choices that everyone made around Thanksgiving, and the kind of exponential growth of cases, and our inability to expand any further means, no, we can't handle any more than this.
We're experiencing a surge right now that was beyond what we saw in the summer, which stretched us. This is beyond what we've seen. And if people don't stay home for Christmas this year, we're going to see something that's, it's hard for me to even imagine. So will we see patients? Will we do what we have to? But the system is already stretched to its, I think, limit right this minute. You heard Dr. Vora talk about the number of ICU beds that we have, and our staff. We have staff that are sick and that are out, so we'll be stretched. And I'm the ultimate optimist person. I believe that anything can be done. I never give up, but I think I have to be honest and say that I don't think the healthcare system. I think it will break the healthcare system if people don't stay home.
The resources get more and more limited, then we have to make more and more hard decisions about who, for example, needs to be admitted and what the threshold for admission would be, and then all the other kind of supply issues that Dr. McMillan talked about.
If we get to a place where there's one, say, I'll just use the ventilator for simplicity, but if there's one ventilator and there's two people that need that ventilator, there's going to come a time, if we overwhelm the system, that we're going to have to make a decision, even though both people need that ventilator, that only one person's going to get that ventilator.
Heart attacks don't stop, strokes don't stop, appendicitis, people going into labor, trauma, all of these things still have to get taken care of, and we just have no space left anymore. So that's the real tragedy, is that on top of COVID, all these other things that just is the cost of living keeps coming in, and we just don't have any capacity left.